Wonderful. Okay, thank you all for coming out this evening. I really appreciate it. My name is Carol Rizzolo, and I'm one of the coordinators of Connecticut Shoreline Indivisible. Indivisible is a civic and politically progressive organization here on the shoreline with 440 members, and we are a group that's strongly committed to civic action. So an important part of our work has been providing educational platforms about the political issues and civic issues in Connecticut that affect our lives. And with that goal in mind, we are honored to have Lieutenant Governor Nancy Wyman and Vicki Veltri, her Chief Health Policy Advisor, joining us this evening for a conversation on health care in Connecticut. Lieutenant Governor Wyman began her career in public service more than 30 years ago. Since then, she has held a seat on the Tallinn Board of Education. She's been a state representative for 4 terms, has served as the state comptroller for 16 years, and as state comptroller, she was responsible for the state employees' health care purchasing as well as the municipal employees' health insurance program. In her current role, she serves as the lieutenant governor of the state. She chairs the Interagency Council for Ending the Achievement Gap, as well as the Board of Access Health Connecticut. That's Connecticut's official insurance marketplace. Access Health Connecticut was created in 2011 and is recognized nationally as one of the best health exchanges in the country, with other states implementing Connecticut's technology. One of Lieutenant Governor Wyman's highest priority is the welfare of Connecticut's military and veterans. In 2007, she spearheaded the effort to establish Connecticut's Wall of Honor, a tribute at the state capitol that honors the military men and women who lost their lives in Afghanistan and in Iraq. She chairs the Rocky Hill Veterans Home Advisory Group and works closely with the Connecticut National Guard to support service members and their families. Last but hardly least is her long list of wonderful service to our state. Lieutenant Governor Wyman is a long-term supporter of the American School for the Deaf in West Hartford. In 2013, she was named to the school's board of directors. She is prominent in efforts to raise funds for breast cancer research. She's been closely involved with Mothers Against Drunk Driving and the National Kidney Foundation and the American Heart Association. And I have no doubt that I have left out many positions and many accomplishments. But without further ado, let's give a warm Guilford welcome to Lieutenant Governor Nancy Wyman and Health Policy Advisor Vicki Veltri.
Thank you very much for having me, and Carol, I really do appreciate it. Carol sent me a message that said she might not be here for some reason because she thought a grandchild was going to be born. Choose me or them. No, the baby hasn't come yet. That's why she's here. Otherwise, she would have the right choices to be with the new grandchild. It's great to be here. Thank you so much for inviting me down here and talking about an issue that I've cared about. So some of the things that you miss, Carol, about me, I was a candy striper when I was younger, and I am an X-ray technician by profession. I should have stayed there because I would have made more money and I would have been But it really is great to be down here. And we're talking about something that really is on the front pages of the papers or on Twitters or whatever that is, and Facebooks and everything else, but it's really about healthcare. As you know, when we talk about the exchanges, many people talk about it as Obamacare. And you know that what's going on with the administration that's in Washington now, there's constant discussions about what is going to happen and what they'd like to do. Before the election was repeal and not replace, and then it became repeal and almost replace. Then it became, and I have to admit that I had one good day since November, and that was the day that they couldn't get it voted on, and so to repeal it. So I had a good day that day, and I cheered a lot. And I cheered because for us, it's a very serious issue. For us in the state, we're talking about over 100,000 people that are on the individual plans. We're talking about over 217,000 people in the state that were on that Medicaid expansion. So we're talking about well over 300,000 people in our state that are going to be affected on what's going on in Washington right now. Many are people that you might not even think of. Some people that are from the ages of 55 to 64 who don't have health insurance, they're now on Access Health. They are they don't have any kind of health insurance. Nothing's available to them except for this, unless you want to pay even at a higher rate. So one of the things that we've seen happen here, people did not know about, when people talked about the Affordable Care Act or Obamacare, they would say, oh, it doesn't affect me any. Well, I want to tell you, those of us that are over 64 years old, or a lot older like some of us, it has affected us even more. People didn't know that because, see, even though you are on Medicare, that donut hole where your prescriptions were being paid for, and they're filling it in so that you don't have to pay as much. Now, if that's erased, if access health, the exchanges are erased, it will affect everybody from 65 years up and older. People don't even realize that. We look at the kinds of people that are on our plan right now. Many people can't get the insurance anyplace else. For example, let's just also talk about the fact that before Obamacare came in, women paid more for health insurance than men did because we could have children. I don't know how alone, but we could have children. And we, as the women, had to pay more for that, which is ridiculous. So Obamacare stopped that. And we think that was pretty good. Think about, now I think about my grandchildren, and my grandchildren are growing up, and I have one that's going off to college next year. Now, kids can stay on their parents' health care till the age of 26. That's a big thing for kids that are just getting out of college, that might not have the right kind of job, but the parents have a good health care plan. This is a good thing for us to have. So many people have forgotten, and nationally we have about 55 million people in America that will be hurt or touched. Probably even more, because that's on one side of it. But when we look at what's going on now, we've got to get up and fight. And we talk about pre-existing conditions. Now, the funny part about this is a pre-existing condition before was that you had a baby. That was a pre-existing condition. Besides the fact of looking at what pre-existing conditions that we do have, so you happen to be a diabetic, so you can't get health insurance. If you had some other disease, you can't get health insurance. That's ridiculous, because if we treat the disease at the early stages, we take care of when people live longer and they're healthier. And we don't have the major costs that are going on, that do go on as we age. So, in my opinion, the Affordable Care Act was a blessing. Are there things that could be fixed? I'm sure there are. We're not going to say that. We need to make sure that we have more people involved in it, and that all people can get health care. So when what we are doing in the state right now, and I'm just going to give you a fast overview of it. We have this thing called the State Innovation Model, which is called SIM, that we talk about, and that basically brings people together to talk about health strategies and healthcare reforms to drive down the costs, because the costs are rising and we have to deal with that. We also, I get the fortunate to head the healthcare cabinet for the governor, and right now we're into examining why our prescription drugs are going up, because they are going up, and we have to figure out why that's happening and what do we do with it. We have a bill in right now, and a wonderful young man named Sean Scanlon, if anybody had ever met him before, he happens to be here, and chairman of the insurance committee, and we love him. There's a bill in his committee that he's gotten out of the committee that hopefully he'll put onto the Senate floor or the House floor soon, and basically it's called the Office of Health Strategies. The cabinet did a study about how we can deliver health services better. How do we get people to do the right things together? Well, the Office of Health Strategy is one entity that will coordinate all the policies to drive down costs. And so I know Sean's going to take this and send it all the way. Yes, give him a round of applause. He deserves it. Sean's doing a great job, and we're very fortunate to have him at the state level. So I'm going to, as we introduced before, that Vicki Veltri is really the person that knows about healthcare the most. So we're going to kind of open up this to questions, and if you please ask anything you want. And if I don't know it, I'm going to give it over to Vicki. And then if Vicki doesn't know, he's going to give it to Sean. No, I'm just kidding. He's trying to whisper down that spot. No, Vicki does know it. But, it's true, though, and I just want to leave this. The federal landscape is causing uncertainty and contributing to a higher cost. It's also driven down the numbers of people signing up for Access Health because they're scared that they don't know what's going to happen, so they don't want to invest in that. So we have some people around now that are not insured, and our fear is that even though under Obamacare you had to everybody had to have insurance, and you could be fined by that, but it's not being enforced, and so we have some work to do on that. So let me. Can
I just make a statement?
Hold on 1 second, Marty. Let me get the microphone so we're going to give it up, okay?
Okay.
I can
You
yell.
do that?
Thank you. Yes, but we...
Okay, so this is a young lady named Marty Carlson.
Yeah, thank you.
So I had the honor of working for Nancy Wyman for 16 years, and I just wanted to say that health care is not new to Nancy Wyman. In 1995, when I joined her office, she had recently discovered that the number of uninsured children in the state was astronomical. She put together a work group, and that work group had all the stakeholders at the table. She led that work group through the conversation of all of this issue regarding uninsured or underinsured children, and from that work group came Husky. And Nancy Wyman is the author of that.
Thank you, Mother. Thank you very much. So, let me
Speak about that, please. Go ahead.
it was kind of an interesting thing because we did get everybody together. We got the Husky program. We had people sitting at the table that had never sat at the same table together. So we had from the right wing to the left wing. So I'd say CCAG to CBIA. Sitting there. We had doctors. We had hospitals. We had nurses. We had everybody that had anything to do with healthcare sitting at the table. And what they could agree on, and the one thing that we found that we could all agree on that we really could undertake is how do we take care of those children that are uninsured? Because as we talked about this, if we don't catch them when they're young and keep them healthy, they get sicker and sicker earlier and earlier. And it's not good for them, and it's not good for the state because they end up on health care for the state, with the state. So it was, I have to admit though, I did not come up with the name. After we introduced it, a guy named John Rowland said, "Oh, I have this Husky plan." Wait a minute, time out, But it was okay, I don't care. But it was successful, and it still is successful, and we have to keep going with it. So it's great to know that kids can have health care. So let me ask you if anybody have any questions?
Hi, my name is Monique Prendergast. I'm a registered nurse, and again, I'd like to thank you for taking time out of your schedule to come speak with us tonight. Do you think that our citizens of Connecticut will have a harder time finding health coverage due to possible penalties because we are a sanctuary state?
No.
Okay.
I don't. I think that the laws that are be coming out, at least what we're hearing now, that has nothing to do with it. I must admit, I keep hoping that what we are seeing coming out of there, and Vicki can talk to all the things that are coming out that are signs of holding on, then there's signs of that are very bad. The terminology has changed somewhat, but we still don't know. So every day it changes. Every day they come out with another statement in Washington. And so we are in the process of really getting people together again, sitting down and saying, how do we get ready for whatever happens in Washington? Because we have so many people of the 300,000 people that could be hurt. Let me just also say that on the Medicaid side of it, for us, it's much more. It's like 700,000 people, but because we have no idea if the federal government is going to change the way they fund Medicaid and reimburse us. And some of the stuff that has been talked about is block grants, or that they would start taking back money, that it would be a 50-50 deal, that the state would pick up the Medicaid and the Fed. That will hurt us. As you all know, we're having some budget problems in the state. And so we don't know what's coming down. And they go with block grant, and what year they're going to use to start the base of the block grant on can hurt us.
So I imagine you're formulating backup plans should the
Oh,
worst
we're trying. It's
Yeah.
not easy to do that because it's financially difficult for us right now. So that's a balancing act, and we're in the process of getting groups together to sit down and say, okay, if this happens, and it'll be bipartisan. If this happens, we'll do this. If this happens, and what can we do as far as we can get right now?
Thank you.
Thank you. Anybody else?
Yeah.
Carol wants it. There we go.
So I actually have, first I really want to thank you for coming. My first question has to do with the children, right? So with Obamacare or Affordable Care Act kind of on the chopping block and this sort of question of what will happen, what does become of Connecticut's kids who are currently covered with Husky? How does that go forward?
That's not.
Okay, that's not.
They're not even on that. They're not on the scoring board at all. They're fine. Husky will continue. That's not one of the programs that the feds are looking at to cut.
And as far as the budget for Connecticut, that's not going to be effective either. Kids who are on Husky.
Kids are not being affected.
Wonderful. Second question
Right
is the second question right now is.
No, I meant
Yeah, The second question has to do with the Affordable Care Act and its coverage of pre-existing condition, but also of women, children, and adolescents. And I know that Sean has introduced State Bill 586 that then protects women and children and adolescents in the state of Connecticut. I gather could you speak about it? I think it obligates the insurance companies, any insurance companies selling health care in the state of Connecticut must offer the same coverage. Is that how, could you explain it?
Come on up here. I'm not.
Yeah, Sean.
This is your bill, honey.
That'd be wonderful.
Come on, Sean. I'll move the microphone up because
Well,
you're
here, I'll
tall.
even hand you this one.
There you go.
All right.
There
Well,
you go.
I'll come hang out with you for a second.
Okay, great.
First of all, let me just say, the Lieutenant Governor is underplaying her role in making sure that Connecticut was the first state in the nation to roll out the health exchange. I mean, we were the first state, I believe, in the country to expand Medicaid, and under her leadership, Access Health has been one of the most successful marketplaces in the whole nation, so she deserves a huge round of applause.
For the record, there was Romney Care in Massachusetts. So it was a little bit different, but I just want to say that. I don't clear.
But in Connecticut, we refer to as Wyman Care. The bill that Carol is talking about, Senate Bill 586, was an effort that was not just introduced by me, it was introduced by many legislators who basically said, look, there's a lot of instability and concern about what's happening in Washington. And many women in particular, because, as the Lieutenant Governor alluded to, pay more than men do for health care. That's a proven fact. There's no disputing that. And so when, under the Affordable Care Act since 2012, about 700,000 Connecticut women have benefited from things like free contraception, free access to cancer screenings, free access to breast pumps, things like that, that we thought, if the ACA went away, would be an immediate cost driver for women, and B, bad policy for about 1 million women in Connecticut who have benefited from this. So we passed this bill in the Insurance Committee. It's pending a vote in the Senate. And when we first introduced the bill, without getting too political here, because I think this is a bipartisan group, the folks that are on the other side of the aisle sort of said, well, this isn't even in the original Trump care bill, so why are you doing it? But as we all know, things change in politics quite quickly. And as they tried to make the bill more conservative to get the Freedom Caucus members to vote for it, they ended up stripping out the protections for women that were in the ACA. So who knows whether they're going to pass a bill or not pass a bill in Washington, but people in Connecticut will know if we pass this bill that they will be protected no matter who is president, who is in Congress. That will be the law of the land here in Connecticut, and so people don't have to sit up at night wondering around the table trying to balance their bills saying, hey, am I going to get a cancer screening this month, or are we going to pay for the dog daycare or the child daycare or anything like that. So anyway, I'm going to see this back to the boss over here, but it's an important bill. Senator Kennedy obviously is a supporter of it, but if you live outside of this area here, please call your senator and ask them to support this bill, 586. It should be a bipartisan bill. It should not be just a Democrat or Republican thing. And I feel that if we can get this done, it'll be very encouraging to a lot of folks here in the state. So thank you.
Thank you, Sean. Thank you. Now you know why I think he's great. Any other questions? Okay, so I'm going to ask you all a question. I'll make a statement first of all, that some of the changes that might come down is the percentage of increase they can charge because you're older. So somebody that's 50 to 64 will be charged more than somebody that's, I was not pointing at me, 27 years old. I'm closer to switching it, being dyslexic, if I wanted to do it that way. And so they want to move it. So it was like 1 to...
It's 3 to 1 now under the law. They wanted to move it to...
Come on, you have to come up here and
or take the mic.
I'll take the mic. There you go.
Thank you.
Yeah, they wanted to change the ratio. So if you were between that 50 to 64 age bracket, you would pay, prior to the ACA, you might pay 7 to 9 times more than somebody who's 27. The ACA came along and the maximum the insurers could charge was 3 times as much as somebody who's in a lower age bracket. But under this proposal that's pending, and again, changes by the minute, up to 5 to 1 could be charged for somebody who's in an older bracket. And that is why you're seeing lots of activity around that particular provision. But that's one of the things that's in the
Yeah. And the fact is that how many of you know anybody that's not on, that's over 65 and that is not on Medicare? Well, I've got to tell you, nobody thought about it, but there's a lot of people out there that are not on Medicare right now. And so they are going, some of them are going, trying to go through the exchange. And the way they're doing it right now, they are retired. They don't collect Social Security, most of them, because they haven't worked long enough and whatnot, and that's why their Medicare is not there. And so these people are even hurting more than anybody else if we lose this. So we're out there trying to push for that. And so some of the things, like we're trying to get the information out to people. And it's not people just in this room because you came out to listen. It's the people that you happen to run into, that you might know, but they don't really come out to any of this. And they might not even talk to you about it. But it's really getting the word out about what is happening around the state. How do you, or people, your neighbors, understand what's going to happen if this happens, and what it means to the state and to many, many of your friends and neighbors in the state. So we're trying to get the word out as much as we can, too.
You want to talk about what the latest proposal is a little bit?
Go ahead. Yes, please.
So the latest amendment that was put out last week, and it's not clear. Hello, Senator.
Hello, Senator.
Hello, Senator. Senator Kennedy just walked in. It's not clear that this will be voted on. If you've been watching the news over the last few days, you can tell that they haven't been able to get the votes yet, but that could change. But the latest amendment that was thrown out there is called this MacArthur Amendment, and that's named after the representative who introduced it. And the idea would be that the states could have the authority to decide not to follow the Affordable Care Act with respect to what's called essential health benefits and community rating. And so I can explain these. Essential health benefits came along with the ACAs. 10 categories of types of benefits that every plan must offer. And these include preventive services, prescription drugs, hospital stays, mental health benefits, etc. Our state, we're fortunate in Connecticut because we covered a lot of these things, but we didn't cover them for free, preventive services, nor did we allow these benefits to be delivered without annual limits or lifetime limits. So for instance, before the ACA came around, if you had a certain kind of condition, there might be a cap, an annual cap that you would be subject to. So if you hit like $10,000 on a certain benefit, that might be all you got. We also had lifetime limits prior to the ACA. So in my former life as the healthcare advocate, we would see a lot of kids and cancer patients, little kids born in the NICU, who would blow right through the lifetime limit, which used to be like $1 million. So if essential health benefits are waived, that could be a big deal for a lot of people. I'm sorry, what's that?
What happened to those patients once they reached the limit and just died?
Please repeat the question.
Well, the question was, what would happen to those patients when they reached the limit? Fortunately, we had a nurse in our office whose name was Maureen Smith, who was the most dynamite advocate you would ever meet, who used to negotiate with our insurers to like trade benefits for kids so they could get some coverage. She was a phenomenal person. But
let's also talk about the fact what really happened to those kids if there wasn't a child healthcare advocate around. Those parents had to try to take care of those kids on their own, and bankrupt. They would become bankrupt, right? The parents would become bankrupt because they want to take care of their child, but they don't have the money to do it. But they would end up being bankrupt, and in the end, we picked them up anyway because it became Medicaid.
yeah.
And the state picks it up anyway. But that's and then so back then especially, that's exactly what would happen.
Yeah, medical bankruptcies used to be one of the top 2 reasons people went bankrupt was medical bills. But the other thing that's in this amendment is called community rating. So you're seeing a lot of discussion this week and even confusion about what's in this amendment about pre-existing conditions. So the Lieutenant Governor talked about how prior to the ACA we didn't have protections against pre-existing conditions. You could get, if you were a cancer patient or if you even took one psychotropic medication or cholesterol meds, you might not even get a policy prior to the ACA passing. Or if you did, you get coverage, but not for the condition for which you were, let's say, taking the medication or something. So it was huge to have pre-existing conditions covered. If this community rating thing that's in this amendment, if a state waived it, it would allow the carriers to charge people more if they're sicker. So you could look at a patient and say, you know what, Jane Doe is 64, she's been to the cardiologist a few times, she may have had a bout with COPD, maybe she has COPD, we're going to charge her a lot more because we think she's higher risk. So that's what this amendment allows. So while it says pre-existing conditions would still be covered, as a matter of practicality, if you're a person who is pretty unhealthy, if this amendment passed and your state decided, well, we'll get rid of community rating, it's in effect basically going back to the way it was pre-ACA. You might get a policy, but you'd have to pay a lot of money. So in reality, you probably wouldn't be able to afford a policy. So that's why there's such concern about what's pending right now. And we just don't know what will happen with it because it doesn't look like, as of the other day, there weren't enough votes. But I think they're still trying to get votes for this amendment.
Thank you. I just have a very hard time understanding what is the thinking for them to come up with this. The way we talk about it, they're the devil, they're cruel, they're whatever they are. I mean, you give an example, and it seems like it's a no-brainer that we would not want to have that. But they are reasonable people. They think of themselves as reasonable people. And I'm asking this question because I want to be able to argue with people who supported the 45th and people who feel that that the ACA was bad and blah, blah, blah. I want to be able to argue with them, so I have to understand what is the thinking? Why would they come up with something like this, other than they're just bad and cruel and mean and they want to go back to Dickens?
Right. And, let me start out with the fact that if you remember what happened when President Obama was president, right? It was a game of what you could stop from happening of whatever he proposed, right? And so they always said that their big thing was, we're going to get rid of, every time they tried, and they tried for 7 years to get rid of Obamacare. Every year they vote for it, but they never could get the votes, right? And so when they ran this time and they thought they were going to win, they used that as, we're going to get rid of Obamacare, it's terrible. Never thinking that there was a lot of people that now, I think I can quote the president by saying, I didn't think health care was so difficult. And the fact is that some people will say, you know, we've given a good we've given people health care, and now people understand it because they have it, and they don't want to get rid of it. Now, if you look at the polling that happened before the election, there was a lot of people against Obamacare. Everybody's against the ACA. You know, and then all of a sudden, when people started to realize what was in the ACA, and this president got elected, all of a sudden now, if you look at the numbers, people are saying, don't get rid of this health care. It's good for people, and people are using it and are better off. But you stand up and say that they ran on this. And the fact is, they're trying to get rid of it because in many places, they believe, and I'm not talking for them, but they'll say, you know, healthcare is none of our business. That should be at the local level or the state level. And I have to admit that a lot of people didn't understand it. And I'll never forget, I was standing with our Congressman Joe Courtney, my Congressman Joe Courtney, from my district, and some woman came up to talk to us. And she yelled at us to say, stay out of health care. You have no place in health care. Leave government out of our health care. And we asked her how old she was. And I then said, are you on Medicare? And she said, yes. I said, that's the government running your health care. Well, I didn't mean it that way then. But really, it is going around and trying to explain to people what is so good about this health care. That in the long run, it will save us money because people will be healthier longer. And we can give you, you know, the women don't have to pay more of the pre-existing conditions, you know, helping narrowing the gender and the racial inequities that happen. Vicki was very kind in talking about one woman, but we didn't forget, one of the things we forgot was the inequities in racial. So if I see a black woman that is that might be heavy set, it might be a good thing that basically is having the history that says, oh, diabetes. Let's go charge her more because she might be diabetic. Or an African American or a Latino child that lives in the cities and say, wait a minute, they're apt to have asthma. Let's charge them more. That's what's out there on that table right now. That's the kind of stuff that we can't afford to have anymore. Because if we don't catch that child and growing up and getting good health care, it's going to cost us a lot more. And that child doesn't produce in a lifetime because they're too sick. And I don't know what argument you can give to them except the facts. And the facts show that if we can give people health care, they live long and cost less. If we get on an even basis that everybody's treated equally, that's what it's all about. And we then grow our state and our federal government, our country better off, our towns better off. Because then, in the long run, we have a better place for everybody to live. And I don't know if that's your argument, if you want to use that as an argument, but I do think you know, we can give you more details, but I'm not sure. Let me.
Well, sorry, but
Get-
what is
get my-
MacArthur?
Get it back, my
So,
bad.
what is MacArthur? He proposed
Please
it.
give her the
What is
mic.
the Freedom Caucus?
Let me take a
The
shot.
the Freedom Caucus is the far left,
Yeah,
far right,
sorry.
on the Republican side. And MacArthur is he is an elected official that came up with a bill, as we have in our state. We have every legislature can come up with their own bills and whatnot, and he's come up with this proposal.
So what I think is, what's going on is a lot of people will say, and what I think is going on with the Freedom Caucus, first of all, is they don't want the government involved in healthcare. But secondly, if you do what's being advocated for a lot, which is reducing essential health benefits, eliminating community rating, things like that, you can go back to a time where you can get a very cheap policy. You can get a very inexpensive insurance policy and say you're covered because you could buy the policy. The problem is it won't cover you for anything. It's substantial. It will cover you for very little, because if we strip out those benefits, you're going to have a bare bones policy. You know, I can get a catastrophic policy that covers me only in emergencies, but it doesn't help me, you know, with my everyday health care. And that's basically what they're saying, is we can get your premiums down. We can get your premiums down because we can eliminate a lot of the benefits. We can make sicker people pay more, and that would reduce the premiums. The problem is it would also lower your benefit coverage across the board, and it would also increase your out-of-pocket costs. So when the CBO came out with its scoring of the American Health Care Act, which is the original proposal, Congressional Budget Office, thank you very much, because everything is 3 letters. Everything in healthcare is pretty much 3 letters, except for AHCA, which is the American Health Care Act. The American Health Care Act was scored, like the office that decides.
That was put out. That was the bill put out.
Right, the original bill that they put out said that so many people would lose coverage. In part, they said that was because people would be paying so much more out of pocket in deductibles, co-payments, co-insurance, that they would not bother buying the policies. They would stay uninsured. So you can bring the premiums down, but when you do that, you're exchanging that for much higher out-of-pocket costs and maybe less coverage. And that's essentially what that bill does.
Please wait till you have a mic. We're being recorded for the
We have such good health benefits in Connecticut. Why are so many people flocking out of the state? Why are we losing population the way that we are? And why do we have a $309 million deficit? Is something wrong there?
That's when you turn it over to me, Vicki.
I did.
$309 million. We have the casinos. We have online gambling now. We have a whole Stanford and all of those cities. I think
You have to use the mic.
they're very, very wealthy, making a lot of money, and some of the corporations were giving many benefits that would cover children until they were 26 years old. So my daughter-in-law works in one of those places. So why is there such a serious problem?
Let me just try to answer a few of them. A few of the comments. One is the health care benefits that are good in Connecticut are because we've been getting help from the federal government because of the Affordable Care Act. And so we've been funding it. It's been a great program for us, and we were able to adopt it. Now, people aren't leaving Connecticut because of the health care problem. And to be honest with you, if you really look at the people that are leaving Connecticut, which is kind of an interesting thing, most of them are probably about 60 years old, somewhere between 50 and 60, 65 years old. They're leaving because they don't like this cold weather. They don't like this cold weather. The interesting part about that, our biggest onslaught of people coming back to Connecticut are somewhere about 80 years old. 80 to 90 years old, because they're coming back to Connecticut because that's where their families are. And then they're coming back, and to be honest with you, what happens then is they get sicker then, right? And they run out of their money because thank God we're living longer, but we didn't always save for it. And they get sicker and they end up on Medicaid. And they're probably in our nursing homes or in some kind of, facility, because that's normally what happens. So on the second part about the budget, and I, can be honest as I can be about it. Nobody had a crystal ball. I will tell you that in the last 6 years, the budget has been cut tremendously. We have gone in the state no more than a 2% increase, which is the best of any previous governors back, but still, the revenues weren't coming in. Are we losing some rich people? Not as much as what people think they are, because most of these people still live down in the Greenwich area, and they still go work because they're the hedge funds, and they go back to work in New York and then come back home because they don't want to live in New York. But we're still losing some, and some of them are retiring and going away. Are there things that we could have done better and should be doing better? Yeah, but it's also unexpected that during the recession we didn't pick up as fast. Though I will tell you that in state government, the legislators and the governor, I think, have done a good job of trying to cut back on state government. We have 5,000 employees down from when the governor and I came into the came into our offices, and most of it was through attrition. We didn't have to go and fire people, and for some reason we downsized government. At the same time, I think the legislature has done a good job of trying to send money home for education and whatnot. When the governor's big push on that, we're trying to do what you can to confine it. I think everybody was shocked to see what happened the other day with a larger deficit. But I will tell you there was meetings going on today, both with Democrats and Republicans, leaders of the House and the Senate, and the governor and myself, getting together to say, okay, now we've got to deal with this. No more playing games, nothing else. We're going back to our employees and asking them to give back. We're doing what we can do to make this state the best state possible. So we're working at it.
Just a quick question.
That's the microphone. There you go.
Sorry. Just a quick question. Has 45 instituted any financial penalties in our state yet that you're aware of?
For sanctuaries.
Yeah.
No.
Okay, thank you.
Not that I know of.
So I applaud the idea of 586, and that's wonderful. And Connecticut trying to do things to mitigate anything that Washington does. But I'm trying to wrap my head around the costs. What costs are we incurring by these policies, given what you just said about the budget? How are we covering these new obligations? And could you help me understand the financing a little bit? And if we don't do that, what would be the consequences? I'm thinking hospitals would be picking up more indigent care and charging more to paying customers.
Right, that's exactly.
Can you speak a little bit about that?
Let me try to do some of this. Right now we are looking at a budget crisis, and a serious one. And so every bill is going to be looked at for what the bottom line is and the costs are. You're right. If we don't do something, we have to. It's a balancing act. It's like walking a tightrope right now. How do we get the services that the people need? To how do we pay for those services? And that's a big negotiation that is going on all sides of both sides of the aisle right now. And so people look at the bills and say, wait a minute, we can't do anything with this bill now because it has a cost on it, right? So we put it to the side. And we're holding it till the budget is decided on and see how we can manipulate so that we get the budget cost down as low as possible and still deliver the services. It's not an easy thing. You're absolutely right that if we don't do some of this, the cost is going to be higher for us as individuals. Because one thing that we've gotten done from the ACA is we've been able to keep people out of the emergency rooms. They were using that as interns office, and just going to it. That pushed the cost up, way up. And now, if we don't keep them out of there, we're gonna see the cost on our insurance plans, whatever you have, going up. So
are you able to say something about, I'm sorry, Sean, I keep bringing up 586. What are the kinds of trade-offs? If we fund 586, we're going to give up what?
But we don't know that. That's not a question that we can answer at all, because that's negotiated, and that's what the whole process is. It's negotiated to seeing what you're going to be able to live with and what we can fund.
That's true. Every single bill that has a fiscal note, we look at those. The genius almost, though, of 586 is it's existing law. So the carriers are already covering these services because the Affordable Care Act requires them to be covered. The ACA requires preventive services. Because the ACA refers to this task force called the United States Preventive Task Force, and it says, if this task force has a benefit that's called an A or B benefit, meaning a highly rated benefit, then you must cover it. So the things that Representative Scanlon was talking about, like breast pumps, preventive services, those things are currently being paid for and covered. So the genius of that bill is it would just take what's covered and keep covering it. So technically the carriers are already paying, at least for that one, the carriers are paying for those services now. Not on every bill, because every bill, lots of bills come out with those fiscal notes, but that one I think should be safe. Unless I'm wrong, Representative Scanlon can.
I hope not.
Larry, sorry.
So I guess a concern in my mind is, will insurers leave the state because in some other state they won't have to pay those things? And that was my second question was, if, why should I care about this MacArthur Amendment? I live in Connecticut. We're taking care of it. Why do I care about what happens in another state? So my question is really, how does what goes on in other states come back and affect us here in Connecticut?
Mm.
Good question. But it does affect us.
It does, because go ahead.
Well, it does affect us because, well, first of all, the current administration obviously cares our current administration, the governor and our lieutenant governor and our legislature cares very much about protecting the Affordable Care Act and the benefits in it. That a later administration may not. I mean, a later administration could say, you know what, the MacArthur Amendment passed, so we're going to waive the essential health benefits. We're going to waive community rating, and we're going to let it go back. So that's one reason to be concerned in Connecticut. Right now, it's fine. We don't know what the future would hold. But the other thing is, what happens in other states affects Connecticut. It clearly does, because we are all paying, there are programs in the Affordable Care Act the entire United States participates in. There was a reinsurance program, like a program to protect the carriers against high risk, that went across all states. It was designed to help carriers protect themselves across every single state that participated in the exchange. So every single state is tied to every other state. Same as Medicaid. Medicaid, even though each state runs its own program, it's a federally funded program. What happens in Massachusetts, the availability of funds for Massachusetts can affect Connecticut. So what happens in every state affects every other state. In terms of the insurers aren't going to leave because, in my view, would not leave because of 586. They're already paying those claims, and they are paid for by their premiums. So 586, the fact that people are required, the insurers are required to cover these benefits, is reflected in the premiums that you're paying. Those premiums are calculated based on the benefits that are offered. So they could raise a premium or reduce a premium if the benefits aren't covered. That would not, in my view, be the reason they would leave, but that's my view. Maybe you have
I think if you look at what the cost would be to the insurance company to leave. And so there's one thing that I should have talked to you about too, because you're going to see it in the papers, and I want you to know it ahead of time, and I'll do this quickly. You know, we have two carriers right now. We have Anthem and Connecticut. And because of the way our laws are written in our state, they have to notify us if they're going to pull out, right? And you will see, and I'm sure it'll hit the papers if it hasn't already, that Connecticut has given their notice that they're going to be pulling out of the exchange. And the reason they're giving the notice is because there's a timeline that they have to do it. The letter basically said, that came from Connecticut, listen, we don't want to do this. We're hoping to ask you for the letter back, but we have to tell you of the intent. And the reason they're doing that is because they're scared about what's going in Washington and what some of the things that Vicki had been talking about. Anthem probably will do the same thing next month unless something is voted upon here, in Washington. We think they're going to be fine. They want to come back into it. They like the plan and whatnot. And so that's just another one of the problems that's being caused by what's going on in Washington right now.
Did they give you a time frame for when they're going to pull out?
They have a year from now. It's about a year now. I think it's like 19. It's 2019, 18
Yeah,
really.
2019 calendar.
And someone put in a bid to take their place?
Sure.
Can I just make one point to Larry's question? I know I can speak for myself. I'm sure I can speak for Lieutenant Governor that we are in constant communication with the insurance companies that reside in Hartford. There are 60,000 people who get in their car and drive to work every day in the greater Hartford area in this industry, and we are very concerned about this. And so whether it's talking to Connecticut, Anthem, Cigna, Aetna, all of these people are constantly in communication with us. And there was a couple times this year when, as the chairman of the insurance committee, some of these folks came to me and said, look, Sean, we can do 586. We can do this bill. But this bill over here, this is a killer for us. That would really be a difference maker. And then we weigh that as policymakers of the cost of potentially losing a huge employer or carrier in our state versus the cost of somebody in our state losing the coverage that we really care about. And that's not easy. But it's certainly something that we are very cognizant of and constantly thinking about in the context of the budget crisis we have and of our economy with balancing the healthcare needs of a state. So I just want to put it out there that we're not ignoring that problem. We're very cognizant of it, but it's tricky and it's difficult, and that's why she's a lieutenant governor, because she has to make these tough decisions. So.
This young lady, that young lady had.
So, considering all of these complications, and unlike the president, I think we see that it is complicated. Do you have any opinion as to when we might move to a single payer, which would take care of all of this in one package instead of 47 patches?
I was asked that question today by a reporter, and I said to her, as I'll say to you, more and more people are thinking about that, but more and more people are also saying, you know what, I don't want to have somebody tell me where I can go and can't go. So there's some people that are still not understanding all of single payer, and people are scared of it. And it basically says the federal government is going to run it all. And, people, as you can tell what's going on in Washington right now, they don't want anybody, they don't want to be running health care. I do believe, and I don't know if it'll be in my lifetime, but I do believe we're going to see a big movement.
In my lifetime.
Me too, but I'd like it because I'm older than you are, so I'd like to see it faster than you.
Well, how about the legislators? They understand that people can be educated.
But the legislators can't afford, the state legislators, it's not in their hands. It's really in the federal hands. The state can't pick it up.
How about Connecticut doing it?
Connecticut doing it alone?
Yes.
We don't have that kind of money to do that. We don't, we're having budget problems.
Less than what we're spending now on all of these patches.
I don't think so. Don't forget, a lot of the stuff that we are doing was done by federal money, and now a lot of it's being picked up by the insurance companies and stuff. So it's not the individuals. Gentlemen over here.
I think one of the things, I'm Steve Jennings from Hamden. I think one of the things that we need to understand as a country is that there are only 2 nations in Europe that have, every nation in Europe, Western Europe, has universal health care, both private and public. Okay, they cover everybody. But only 2 nations have national health care. In other words, run by the national government. That's Britain and Spain, as far as I know. So they cover everybody, but they do it with a combination of private insurance and public insurance, government insurance. So, you know, that could be an intermediate step. And Obamacare was on the way to doing that until, you know, now. So I think that's something we need to perhaps embrace instead of going all out for a single-payer system, which I think is probably unrealistic politically. What do you think?
You know what? It's a step in the right direction, and I'd try anything so that we can get people covered at this point that would be accepted in this country, and of course in our state. And it's hard to. It takes a while to get people to change, right? It really does. And so more and more people need to be speaking out on this. You know, who would have ever thought that we'd see people do a march on science, right? Yeah, just because we were out there together. But a march for science, you know, things are changing. And they're really changing. And I have to say it, I think it's because of the administration in Washington. And maybe it'll change for the best. How many times, I mean, I look at your group tonight, this is wonderful. On a Tuesday night, couldn't you do something better, you know, and come out? I mean, no, the people are excited about change. So the ideas are out there right now, and we've got to start speaking out on those ideas. And what you're bringing forth is absolutely right. It might be a step towards that single payer, but it's a different way of doing things, and we need to speak out on it. So I thank you very much for doing that, yes.
Representatives in Congress have signed on to H.R. 676, which is a single payer, 109. It was 93 at the 1st of April, so it's going up.
Great. That's great. We love it. We love it. Yeah.
First of all, I want to thank you very much for being here tonight and for coming to the STEMCon on Thursday, I think it was, which I attended as a scientist. My question, and the March on Science. So the question I have is about Medicaid and the expansion of Medicaid. First of all, it's a great thing that it's been expanded in Connecticut. But I know there are limits, so that goes up to 137 or 38% of family leave plan. Yeah. And so once we've reached that maximum, do we get to go, will we continue to get federal funding once we've reached the maximum?
It doesn't sound like it, but Vicki will take it.
And I guess it depends on
what they do.
Like any lawyer, I'm going to answer it depends. But anyway, the Medicaid limit, the Medicaid expansion is for primarily single adults or couples without kids, up to 138% of federal poverty. If you're over that income limit, and the income limit's different for kids, you would probably go to the exchange and try to buy an insurance product. If you're on the exchange and your income is below 400% of federal poverty, which is about 90-something thousand for a family of 4, you would get help in the form of advanced premium tax credits. At least right now, under the Affordable Care Act, you get what's called a subsidy or an advanced premium tax credit. So it helps you pay your premium. It goes directly to the carrier. You don't even see it. So if your premium was going to be $900 and your advanced premium tax credit is $600, your premium is now $300, and that's what you pay. And if you're in a group that's very low income, so let's say right over that Medicaid limit, but below 250% of federal poverty, which is obviously lower than the 400, you also get help with co-pays and deductibles and co-insurance. Those are called cost-sharing reductions. People get those. And that is the hot subject right now down in D.C. because that's the thing that is not being guaranteed beyond September 30th right now by the administration.
Would that include the disabled as well?
Disabled qualify for a different kind of Medicaid program called, we call it Husky C here. There's a group of people aged, blind, and disabled who can qualify for Medicaid if their income is very low. If their income is above that, then they also, they may qualify for Medicaid.
But that's not up for discussion right now. Even the president said that they would not touch the disability at all. They would not be touching the disability at all.
We're not even.
Now, the other thing, though, is they might be looking at the expansion of the Medicaid and not wanting to fund it. But because there are states that did not expand it like we did. And so some of those states that happen to be of the same party as the president have not done that. And so they're saying, wait a minute, you can't figure out our reimbursement because we didn't do the expansion, and you can't use that reimbursement on the people that did do the expansion because we'll get more money. So there's a big discussion about that going on in Washington right now, so, and hopefully that the good will survive. And I thank you very, very much for tonight, and I thank you all for coming.
I really just want to again thank Lieutenant Governor Wyman as well as Vicki Veltri for coming out to speak with us. Thank you to all of you who, as the Lieutenant Governor pointed out, had nothing better to do this evening. Just to say, there are several phone banking events around this Senate Bill 586 around the women's health care. Planned Parenthood of Southern New England is hosting four phone banking events. The Indivisible group, Shoreline Indivisible, will be staffing the one tomorrow evening from 5 to 8. There's another one on May 17th, another one May 31st, and another one, I believe it's June 7th. We will be posting all of that. What we'll be doing is calling into Planned Parenthood supporters around the state and asking them to contact their legislators to push and pressure, I hate to say that, but to pressure their legislators into voting. And the thing is, what Sean didn't say is, and just didn't describe, is that what happens is now that this bill is out of committee, it needs to come up for a vote in the Senate. And without a lot of pressure to have it come up, these guys have lots of bills that they are trying to pass quickly. Theoretically, their session ends the beginning of June. So if this bill doesn't come up for a vote, it will die. And if it's brought up again next year, as Vicki pointed out, it's not really clear that we'll have Democrats or supporters in the Connecticut State House or Senate next year. You know, at this point, we've lost seats in the House from the Democrats, and the Senate is 50-50, and which means that if senators split exactly 50-50, if that bill comes to a vote, then we have, of course, Lieutenant Governor, who becomes the tie-break, and then the...
Okay.
He needs to be our next governor.
Right, but what we don't know is if State Bill 586 doesn't come up for a vote and dies on the vine and comes up again next year, then women, children, and adolescents in the state of Connecticut are not going to be covered. It will be a pre-existing condition if you've ever had a baby, or if you are a female, mammograms won't be covered, pap smears won't be covered, preventive health won't be covered, certainly reproductive health as well. So I would just ask you folks, please call your representatives, call the senators. Sorry, guys, I know you guys are in the room and you're both supportive of this. Please speak with your family and friends who live in other parts of the state. Encourage them to call. If you're interested in phone banking with Planned Parenthood Southern New England, you're welcome to call me, or you can call Gretchen Raffa. She's the one who is coordinating the phone banking. So again, thank you to the Lieutenant Governor for coming out. And